Welcome. It is April the 19th, Wednesday, and this is the Health, Wellness, and Lifestyle Program with Linda Dorman and Dr. Donna Christensen and our wonderful guests, whom we'll be excited to introduce in just a few minutes. Want to give a station call out to OurTV.network. You can also catch us on Amazon Fire TV, Android TV, Roku, Apple TV, and WSTX Bloomberg Radio. So, good afternoon, ladies. How are you?
Great. Good afternoon and welcome, Dr. Prasad.
Thank you so much. Thank you for having me.
Yes. Do you want me to go right into an introduction? We're going to talk today about adolescence and perhaps some related public health issues. And so let me just do a brief introduction and we can get right into it. Dr. Prasad has held leadership roles in community and state public health initiatives in adolescent and school health, primary and preventive health care, rural health, and maternal and child health. For 10 years after Hurricane Katrina, she championed school health equity initiatives in New Orleans through initiating cross-sectorial collaborations between education and health sectors, something that we're trying to establish more firmly here in the Virgin Islands. She served as a health director of New Orleans before relocating to St. Croix and recently secured a $2.5 million policy grant to address infant health equity for a federally qualified health center in New Orleans. Her public health work consistently values community voice, working in partnership with public health and other nonprofit and governmental sectors. She's currently the principal of Policy and Action for Community Health, PAC LLC, which is a vehicle for providing technical assistance to nonprofits and governmental agencies. So that's just a brief introduction.
Thank you. Very kind.
If you wanted to add anything to that introduction to let people know a little more about what you do.
Just one thing. Thank you, Dr. Christensen. And I think the most important thing would be my tenure with school health, school-based health centers in particular. And so that may actually relate to our conversation today.
Sure. And, if it's all right with you, we can go by first names.
Thank you.
Make it a lot easier.
I appreciate that.
Yeah.
And so I'm really excited when Donna mentioned that, she had invited you on the program and we get a chance to kind of, tag team on those who come on. I was extremely excited because I am a mother of adolescents and the health equity, school-based issues, access to care, pediatric health, mental health, and behavioral health services are something that I know that many parents, including myself, have struggled with in our school system, particularly post-COVID, seem to exacerbate underlying health issues, mental health, behavioral health issues, just that naturally come living in society right now as an adolescent. So I'm looking forward to this conversation. I want to. Usually I have 1,000,001 questions, but I'm going to try to do a little bit more listening.
She still will. And just as a little more background, I wanted to go into adolescent medicine. I did two externships up at Children's in their adolescent clinic, but coming home, it was just not possible. I ended up, and I trained in family practice because I didn't want to do pediatrics. And it gave me a chance to be trained in a variety of subjects matters that would apply. But coming home, I had a family medicine practice.
I wish that you had done so. And I'll tell you why. I think that in my experience working in primary health care, and then again, that whole issue of school-based health and so forth, one of the things, and even being a mom and having had an adolescent,
that too,
what's really clear is that pediatrics typically does not address the needs of the adolescent. So you know that your child is having issues around stress and sexuality issues and maybe experimenting. And this is not everyone, but some people. You make an appointment with your pediatrician. The two of you walk in and the waiting room is full of toys babies crying. All the images on the wall are Disney characters. And immediately there's the sense for the young person involved that, why am I here? I am not a child.
Mhm.
And so there's a need because adolescent development is a unique science and certainly a unique area of medicine for the area, but there's just a lack of those types of specialists are available to families. So
Maybe to get us started, could we talk a little bit about what goes on in adolescence? That what are some of the things that we need to pay attention to? I know that one of the areas that I'm also very concerned about is that 0 to 3 time when the brain is really developing quite a bit. But adolescent is another time. So could we just set sort of the stage so that we can all understand what's going on in adolescence?
Well, thank you so much for starting off in that way, because I think that adolescent brain development in particular, although there's all sorts of things going on with adolescents, is an area that is critical to how they respond to life. Okay, so in addition to the fact that physiologically it is a time of huge hormonal surges. Also, their physical body is changing, as you know, they're getting taller. They may look a little awkward during that stage. But I think that fundamental to all of that is this issue of prefrontal cortex development.
Yes.
So that's really the front of the brain. And there are lots of great papers and good information about this, but it's not anything that you necessarily, it's not widely available, let's put it that way, or widely discussed. But essentially, that part of the brain is where focuses on cognitive development. And so you think, okay, these young people they're there, they can talk about any subject, etc. But in fact, they're still they don't fully mature from a brain development perspective until their mid-20s, typically. Now, of course, there's a spectrum for everyone, and some young people
Yeah.
but typically in the mid-20s is when that particular part of the brain is sort of completing its development. And as a result of that, so what does that mean? That means that young people's ability to process long-term consequences of their actions can be impacted by this lack of prefrontal cortex development. They may be tempted by their peers to drink alcohol and drive. Oh, you're fine. But they're just not fully processing the impact of those actions. And it also has an impact upon their socialization. So socialization is a process that actually helps with brain development, which is kind of tricky in that many kids are socializing now over their telephones. So that interaction that should be occurring between peers and with parents and with teachers is often suppressed by this new technology. So I don't know that the jury is still out on all of the impacts of that. But we can suffice it to say that the lack of fully developed frontal cortex functioning impacts young people in their decision making and their understanding of long-term consequences. So then you take that developmentally with the surge of hormones, which affects their emotions and makes them reactionary and lash out sometimes. Also, this whole issue of peer pressure, which certainly relates to those things where they are listening to their peers and not necessarily listening to adults. All of those things, self-image, which certainly has to do with their physical development. Those are some of the factors that relate to adolescent development that I think will impact the rest of what we have to talk about.
Yes.
I'm glad that you set the stage for the conversation that way, because I've often been curious to understand, my thoughts as a teenager and how I look at my teenagers now and try to find some similarities, some similar ground so I can have a base of understanding as to where and what and how they're processing information and therefore their ensuing actions. And I'm it's a struggle as a parent, but you still try to provide that that support.
Guidance.
What's new now that I'm curious about are things such as gender fluency, this concept that wasn't a concept when I was coming up in high school. That was
What is that, Linda?
what is that? That means that you are
Well,
not
gender.
gender. Yeah,
Identity.
Gender.
so
Yeah.
some would
Yeah,
call us.
no, I got it. I thought you said ginger, and I was
Oh,
like,
ginger.
yeah,
No,
gender.
no.
No
That's after the
question.
program, but no.
Absolutely. Go ahead.
So gender fluency, or these introductions of the fact that there is no gender or there are multiple genders. That's one, and then two, the this really, I think, a rebirth of a sexual revolution that we're not willing to really have a conversation about, because there's so much opportunity to see that in social media, and therefore espouse to emulate what you see. um, it just, I'm wondering how that has created a more dire situation, or has retarded some of the, or pulled back some of that developmental, or is that why we're now pushing into our mid 20s and saying the brain, that piece of that brain does not close up? I'm just curious about all of that.
Well, I think the whole issue of gender development is, our gender identity is not new, but it certainly is much more. There's a social awareness now of a continuum, and young people seem to be a great deal more open to the idea of gender fluidity than certainly we are as adults. We're a bit rigid. From their perspective, they see things a little differently, and their sexual, let's say, I'll say, orientation is just a bit more open than our perspective. I think we shouldn't, as adults, as parents, as teachers, as leaders, we should recognize when we really need help with those issues. These are not easy issues to process. And again, it probably would be another whole area of adolescent medicine development that physicians need to go into. But oftentimes we need specialists to help to intervene and have some of those conversations to make it easier for us as parents to feel comfortable with our children, with our adolescents, and help them to transition through the.
And I think I would certainly agree, and I would just, as I think about this particular facet, it's really, how does that impact on the senses, on the development, on the science of the brain, and the hormones that develop? That, are we opening up those hormones too early, and therefore it's ricocheting against a mental health, or it's ricocheting against a self-perception, or key risk earlier key risk behaviors than we have thought of. And from that perspective is why I'm bringing that to the forefront.
Can I just add before you answer, Marsha? The developing your sexual identity is part of the work of adolescents as they grow and become adults. It's part of what everybody goes through. But I'm wondering if the openness to the gender fluidity and all of the things that are now more open, does it create some sort of confusion for them? Or does it make it harder for them to really develop that sexual identity?
I think it does. And I think sometimes adults contribute to that confusion, and media contributes to that confusion. So the only remedy that I see is that, just like when we had infants and we read all the books and tried to get all of the information so that we could do the best parenting possible, we should be every bit as vigilant when we have adolescents to try to understand what those possibilities are. Keep your ears kind of perked to find out what the conversations are. Look at the friends that your adolescent may be engaging with. I don't know that it's negative. I think that it's all a part of that socialization that really helps development, but we want to provide positive support
Yes.
during that period. And if you can provide positive support either directly or trying to steer them into, things that they're interested in, then that's going to help with that development. And the focus isn't all there. I think sometimes we make it worse when, as adults, we have negative things to say. We pick out the negativity around sexuality. Oh, look at him, as opposed to being more open to possibilities.
I think that's the key. Just being open and able to talk, hopefully able to, have some open, non-judgmental discussions around it to help them
And
support
frankly,
them as they go through their
right,
decision making.
they may not want to talk to us all the time as
That's
adults
true.
and parents.
That's
So
true.
that's why, for me, one of the big things that I advocated for throughout my career was school health education, school sexual health education, and really comprehensive sexual health education, comprehensive adolescent education that did not just focus on sexuality, but focused on the entire range of development. So it wasn't the parents who were against this. The parents were like, yes, we would like our kids to engage in facilitated conversation
Absolutely.
by caring, informed adults in this area, because this isn't always something I can talk with them about. And so sometimes community solutions are the way to go with this. But there's a lot of conservatism that, believe me, I fought battle after battle to try to make adolescent health education available, comprehensive health education available, particularly to kids of color and to schools that were predominantly young people of color. And I think, to me, it was an equity issue, because as I explored other settings and other private schools, they were actually much more liberal and their kids had access to this information, whereas there was this conservative members of the school board that says, no, we're going to concentrate on reading, writing, and arithmetic, as though these other things that kids are concerned about don't impact upon their success.
How in that, and you're spot on, because I have my daughter goes to a public school, and I did that purposely coming out of private school that also was extremely conservative, Seventh-day Adventist school, and so creation in its conservativeness was taught. So I wanted to make sure that it was very challenging. That they had a chance to be exposed to real world. And so we did have a lot of conversations, and we all had our different opinions, but they didn't feel. We have something called CWJs, conversations without judgment. It's a cool way because they talk in 3 letters. So we came up with the 3 letters that I could feel like I was in their bubble. And it was very, very interesting conversation whereby school-based health and adolescent health services are contracted in our school system. We contract them in. However, there's just not enough resources to bring in a full complement of services. So it's constantly being high level, but it needs to go deeper. What would you say to parents and educators who are trying to educate around these issues? How do we advocate for lowering the barriers to these services and bringing greater equity across school systems, regardless of location?
Well, this is tough. One of the projects that I did that was most significant, I think, was an evaluation of adolescent health curricula. And basically, it turned out to be a research project. So we had several different kinds of models that were being tested in the community. And I think that, at the end of the day, parental involvement in that was always an issue. So what we had to do, because of course we couldn't violate any of the school rules around abolishing sexual health, but we had to individually contact lots of parents to say, would you be willing, are you interested in your kids getting this type of comprehensive education? Mm-hmm. And so, believe it or not, 75, 80, 90% of them said, yes, we would like to have this. I think that they just have to make their wishes known to the individuals. That's why you have a school board representative. You know, your school board representative is supposed to represent the issues of you and your community. And you might say, hey, my kids are being inequitably suspended. What's going on there? My kids are, I feel as though they're being discriminated against in some way or another as it relates to how they express themselves. Like maybe they are having a gender identity issue and they come to class and they may be presenting themselves in a way that makes the teacher uncomfortable. And so what's the solution? Okay, in some instances, they're the first ones to be suspended. I mean, they're even egged on in terms of, and of course, I wouldn't be saying this if it weren't examples that I have discussed with parents. So I think that parents have to advocate with the school systems. They have to make sure that there is someone. I mean, even if every teacher can't be that teacher, they have to make sure that the school has at least one person or two people that students who are questioning can go and speak to. They have to make sure they have school counseling, and they have to make sure that the first reaction to any problem that comes up is not suspension, which is often the case.
Yeah.
Especially for Black and brown students, more so than for anyone else. But, you know, also PTAs have a lot of influence. Our system is a little different than the stateside system in terms of school boards. But as a PTA president and then working with the health department, we actually created a sex education curriculum. Parents said no, but they said no. So but that was many, many years ago. That was in the 80s. So maybe now it's a little different. But I think maybe the answer is what you've been talking about, a comprehensive adolescent curriculum that is added in the school, because it's not just about sex, it's about violence, it's about interpersonal relationships, and it's the whole, all of what they need to be able to be discussing and getting support for as they grow into adulthood. So maybe we have to just focus on sex by itself.
Exactly. I would totally agree. And in fact, as far as the young people, I was talking about this more or less community experiment, but the curricula that they liked the best were comprehensive, where they talked about physical activity, diet, relationships. And then they had great fun. They really enjoyed it. And the sexuality part of it was integrated pretty seamlessly. And so, I think that is much more effective than just saying, today we're going to talk about sex, because it becomes distorted.
Yes. It really
and I can remember.
Yeah. And there are some conservative communities that like mine was, at least at that time, that will not allow for that to happen. But when you do it in a comprehensive way, I think
there's an interesting conversation born out of really where's the gap in involving the students in that curriculum development, because they're really the ones that can give some guidance in a way that's more meaningful and engaging. And I think that that's critical for the adolescents, to get them engaged in the design, the development, the execution, and even in some cases, peer-to-peer conversations with facilitated experts that are really walking them through the complexities of what they're experiencing. Just being an adolescent and then having to learn, having to grow, having to, as my young 16-year-old daughter says, I'd like to see a summer course on journeying to womanhood. I thought, wow, that's pretty deep, young lady. Can you tell me what you mean by that? And she said, well, I'm scared to go and become a woman because you're doing everything. And I realized that while I thought that was my superpower for her, it also kind of frightened her. And so I said, well, let's collaborate with some others, and let's just put together maybe kind of a mom-daughter, couple of couple of sessions, conversations. And then it's now looking like a full summer, week-long, actually funded program, with her invoice and her input. So it's pretty interesting.
We're coming up on a break time. I haven't gotten a signal from Anthony. I guess we'll get it soon. But yeah, one of the things after the break, perhaps I'd like to talk about a little are some of the issues that impede that growth and development that our children are experiencing and how we deal with that. Anthony, do we need a break? I know we're at the 25, we're at the 26.
Well, just in case we do, I'll just kind of take us to the mid part of the program and just say we're looking forward to continue the conversation with Dr. Marsha Broussard, with Donna Christensen, and I'm Linda Dorman with the Health, Wellness, and Lifestyle Program, talking about adolescent health. And if we don't go to a break,
well, let's just continue because he hasn't answered. So we'll just continue until we.
Today we're taking a little vacation on the west end of St. Croix, visiting a seaside restaurant called the Beachside Cafe here at Sandcastles on the Beach.
The atmosphere is just wonderful.
You just feel very welcome when you're here.
Hi! I'd like to introduce Chris and Ted, who are the owners of Beachside Cafe and also Sandcastles on the Beach. This is amazing!
Thank you.
Sandcastle on the Beach is quiet and friendly, relaxing.
I often entertain guests, and this is the one place I always try to bring people.
Tell us a little bit about the hotel.
Well, the hotel is a 25-room hotel. We have 10 different room types within that. We also have, of course, our greatest asset, the ocean out there, which our side of the island is very calm typically. So it's the best swimming beach and also great for snorkeling.
And just walking, doing a nice walking beach tour.
Absolutely.
Yeah.
Best beach access is right here, so we love them.
And we're also fortunate we have just up the way Sandy Point National Park, and then Frederickstead Town is just a mile away. Mm-hmm. And so we're really fortunate to be in this perfect spot.
Well, here we are. We're back. We can see each other now. Before we
Yeah.
couldn't. Well, welcome back to the second part of the Health, Wellness, and Lifestyle Program with Linda Dorman and Dr. Donna Christensen. And we're very happy to welcome to the program Dr. Marcia Broussard, who is with the Policy and Action for Community Health, LLC, all out of the wonderful island of St. Croix. I wish I was there with you ladies. I'm here in Philly, Maryland, but we're okay. We have good weather as well.
It's not that bad. I'm up there.
You're up here. Okay, great.
Yeah, I was at a
Yes,
conference
great.
for the last couple of days.
Great. And we were talking, Donna, you posed a topic, a kind of a pinpoint as to where we would pick up the conversation, and wanted to just reintro that for our listeners.
Right. Because there's so many, when, I don't know, but probably all of us, when we were growing up, we did not face a lot of the challenges that our children are facing today. And many of which really impede their ability to do that brain development and to socialize well, and just develop the kind of value system that's part of what they should be going through at that time. We didn't have bullying, and I don't remember being bullied, for example. Drugs were not a problem. Maybe alcohol, but it wasn't a big deal. So what are some of the things? And of course, we see a lot of marijuana smoking in our adolescents these days. And I just think that that's something that must impede their ability to develop the kind of neural pathways that lead to a healthy adult.
And can I add to that before Marcia? Those are very good points before you kind of break that down for us. I would also say that the real proliferation and just almost obsessive or addictiveness to social media, where study after study demonstrates the erosion of the capacity to make good decisions because you're so highly influenced. I mean, this is the argument that is underway with certain media platforms. I can appreciate social media in the sharing of information and getting that out there, but now it's so much information that
and sometimes wrong information,
and
harmful
the
information.
But to your point around the use of drugs, I mean, obviously in many states, marijuana use is now cannabis and certainly available legally. But give us, kind of walk us into how all these social constructs have really hindered or helped us to examine adolescent health, and what do we do about it?
Well, I want to go back to where Donna started, and that is that when we were growing up, I don't recall being bullied, or I don't recall kids having the same kinds of challenges. And she knows this, and I'm sure you do too, Linda, but there's something called protective factors, and then there's risk factors.
Yes.
And protective factors in public health basically are environmental, they could be physical, they could be a variety of things, relationships that help to mitigate, bad situations. So when I was growing up, I can think of, lots of young people who were my peers, and we had a great group of teachers who essentially they were a part of the community. And the sense was that we were a part of their total responsibility. So again, when things happen, it wasn't always that send Marcia to detention. It might be, let me just call up Miss Edwina and let her know what is going on with this girl, or Mr., my father, or whomever. And also on the way home, once we were out of that environment, there was this sense of community where, again, Miss So-and-so had just as much right to chastise, to punish, to do things that were, that bad behaviors that I might have, as my own parents. So those protective factors, I would say, other than I know there are wonderful teachers in the school system because I've met tons of them, But there also were a lot of others who came into the system who didn't have that same level of commitment for a variety of reasons.
That's
Teach
true.
for America, different programs that brought in different teachers who were not community based. And so I don't know that there's any going back to those.
I wish we could go back to the community thing, because that's how I grew up too. Everybody had a hand in
That's right.
supporting
And your-
you or chastising you,
behavior.
whatever the case may be, or just telling on you.
Yeah, they'd tell on you, and you know, they could spank you, and then you'd go home and get the other spanking from your parents. And as much as we joke about that, it sounds trite. It is very true. So
Children need to know that they're loved, that
Right.
somebody cares about them. And I think that's the benefit of that, if nothing else.
Well, and
having boundaries.
if in the gap now, the constraint really is because we have built so many policies and, in fact, procedures at the state level that really actually legislate those behaviors and make them offenses and punitive for the teachers. So the teachers are desensitized. They may want to take action. But now we have news stories where young people, 6-year-olds with guns, are coming to school, or 2 boys who were just found guilty of killing, I think that was their Spanish teacher, and they were intentional. All the lives around that story and those kinds of stories are destroyed. But how is there any way that we can reinstill that village mentality in this adolescent health space? That's a critical. How do we empower the adults to not be fearful to engage?
I think that's getting harder because, even you can't teach certain things now. You can't talk about certain things, or you can be penalized, criminally,
For discussing.
So it's going to be harder we just have to do the best we can.
I would agree. But it's clear that, we certainly are not giving up on our young people. And so we're going to have to continue to try to improve those protective factors around them. So we talked, so moving forward, we talked a lot about social media. Well, let's just take that one. I think that parents are often reticent or afraid because they're thinking about the relationship they're trying to preserve with their young people, to restrict as much as possible some of the social media. But that just is one of those things that if you can do it, if you have the bandwidth to be able to pay attention to that, is a good idea. Too much media time for a 13, 14-year-old is simply not going to come necessarily to a good conclusion.
Right. And I watch my daughter and my older daughter too. Her 2 kids are really on the computer all the time, but she makes them, put it down and converse.
Right. Play a game.
Interact
with a game.
Yeah.
Be creative.
And the activities that they started doing, I think, was really a good idea. Like going to the museum or going bowling I think we need to
And I made social media unpopular in my home by simply engaging with it more than my children. And it became literally the worst thing. Yes, they are no longer hours of TikTok. I must admit, sometimes I feel that I am, but it's interesting in that what I discovered in our conversations around, and I would imagine that's a risk factor. You talked about the protectors, and I would imagine that that's an example of a risk factor, because it's eroding opinion. It's really accepting the influence, and that's why they're called influencers on these platforms. Is we've talked about the meaningfulness of the information shared, to the point where it becomes almost a debate. It's almost like so-and-so influencer, and that's why their influencer said this, and that around gun violence. Mom, you're not clear or up on your information. And I find myself almost competing with the voices that I don't know, and trying to ensure that they're getting the right information and processing it in the right way, so they can use it to whatever benefit. So it feels like it's an ending battle when you have very opinionated children who have gained that have been duly influenced in that regard.
Mhm.
Would that be a key risk factor actually considered?
You mean the
Social media
exposure?
exposure, yes.
Yeah, absolutely it is. And I think that as parents, we have to ask ourselves how when is it the appropriate time to intervene? And I think the younger the better. You know, a 7-year-old having a cell phone is simply not necessary. I don't
Agreed.
really think. And so you know that, you know, you might have some opportunity between 7 and let's say 13 or 14. And as they get older, that's going to be more difficult. But those values can be talked about over the dinner table when they're still at that age where they might be a little bit, you know, mom says you need to put that cell phone down so that we can, you know, have this conversation. So the younger ones are kind of policing the older ones, so to speak. When they get to be a certain age, it's just really hard. But hopefully by that time, there's a sense of etiquette, you know, that I don't talk on the phone when I'm doing dinner. And that when we're having a social experience with relatives and grandma and whoever, I don't talk on the phone during that time. And so that is something that can be, I would imagine, can be cultivated so that as young people get into their older teens, you know, they kind of have a sense that, you know, I really shouldn't be doing this. This is a time for me to spend with family. Other than that, you know, it's tough. You know, parents do have, since most of the time we're responsible for purchasing that media, we can put some restrictions on it.
Yes.
But, you know, young people, as they really do find ways to get around things.
Yes, they do. I've always, no matter what it was.
Brilliant.
But, you know, I'm concerned. I know we still have a little bit of time, but I don't want to get away from the influence of cannabis, because it's becoming more places are allowing for recreational use, although restricting it from maybe people under the age of 18 or 21, but they've been smoking for years. So how does that affect the brain development? If you have any sense of
well, if you can imagine, cannabis, alcohol, and oftentimes they're utilized, you know, at the same time, they do, at least in terms of older adults, you know, there's this debate that goes on that says that it doesn't really hurt the brain necessarily, but I don't. What literature that I have looked at as it relates to adolescent development, again, this is a time of brain development. So THC is a chemical that can have an impact upon that brain development, is what I have read, and I hesitate.
I have to.
Yeah. Okay. Good. Because you're a physician, and I don't want to pretend to know things that I don't know, because it's really important that we give our parents accurate information. And so the other factor that goes into it is the degree. So it's, you know, it's not good for young people to experiment, although it's going to happen. But when it ceases to be an experiment and it's an everyday thing, when every day, and cannabis is one of those things, it is very difficult to disguise when someone is around cannabis. You're going to smell it. Yes. When the kids come in from school, it's going to be in their clothes. So how often is that happening? Is that happening all of the time? Is that, you know, does their book bag smell like, you know, cannabis, or is it just something that, you know, you might pick up occasionally? So I think the idea is degree. I mean, and again, you certainly want to have those conversations that marijuana use is, you know, put that off until if you must think about it, put it off until much later in life when there aren't so many things at stake. And again, we're talking to adolescents, so they're not always listening. They're listening to their peers.
Exactly.
But I think that where it really becomes an issue is when you think they have a habit, and that habit can really impact their development, their social and their emotional and their physiological development.
Yes. You know,
it must affect their ability to learn, you know, to really focus and learn. in the education space.
Well, again, this is a time of high hormonal
Yes.
surges. They're already having issues around anxiety. So one of the things that is well known about marijuana use is that it can cause what they call paranoia, or anxiety.
Oh, okay.
And so,
well, that's
right.
interesting. I
So
would have thought that it would be quite the opposite, that it would kind of
It
zen
does
that
both.
down. It does both.
it does
It
both.
can,
And
yeah,
maybe
it can do or it can do
Right.
either.
I'm not pretending to be an expert, but initially it might kind of give you that fun from what I've learned about it. But then over time and again with use, it's associated with paranoia. And so if you have a young person who's using marijuana regularly and they're already experiencing a surge of hormones, because that's just a part of their development, then that could exacerbate how they react to certain situations, sort of flying off the handle. And the next thing you know, then that leads to some other negative outcome. It could be some bad interaction with the police, or it could be some bad interaction with someone in school, one of their teachers, whoever is in charge. And then they may end up in some type of situation that requires legal intervention or whatever. And we know our children do not have the resources often when it comes to parents, trying to work through these things. They may be the ones that end up in juvenile, when in fact it might be something minor, or nothing is minor, but it may be something that if the parent had resources, could have been circumvented in another situation.
And the challenge that one of the principals at my daughter's school around this subject, and I also want to make sure we leave some time to talk about your work at your organization,
Yes.
Policy and Action for Community Health. I think it's really important to lift that up. But the principal really talked about the challenges. When I brought this to his attention, my daughter said there was, very prominent smell in the hallways. And I said, well, can you address it? He said, well, sometimes it's not just the kids, it's their parents. When we call the parents in, it's evident that is something acceptable and shared and an okay lifestyle, if you will, in the home. I said, okay, so then I've got to do my own research, help prepare my child to navigate through that, if that's, and not get swept up in the influence. Are there policies or in your work through the LLC, PHCH, tell us a little bit about the types.
Can I just read one thing before we go to that, and then we'll
Absolutely
focus on that? This is from CDC, teen marijuana and the teen brain. The teen brain is actively developing and continues until around age 25. And these are possible negative effects. Difficulty thinking and problem solving, problems with memory and learning, reduced coordination, difficulty maintaining attention, and then the problems that, as you've mentioned, with school and social life. Those are some of the things that CDC noticed in adolescents who are using marijuana. But yes, let's talk about patch.
I appreciate that. Briefly, because, PAC is something I created. I've had 2 stints of not being formally employed, and I just, I still do the work. Katrina, we finished about 10 or so years of school health work. And I don't know if you all were aware, but Katrina caused a great flood of resources into the New Orleans area.
Yeah, I spent some time down there after.
Yeah, right. And so unfortunately, as the years passed, and we did 10 good years of work, but as the years passed, the investment declined. And so lots of agencies began to downsize. And me being a mature Black woman, I was downsized out of the agency that I worked for. And as a result, I formulated Policy and Action for Community Health because I wanted to continue doing the community health work. And in fact, I did some work for that agency, the Louisiana Public Health Institute, that kind of launched me. And it was it was actually adolescent health related work, working in communities in rural areas, because that happened to be one of my specializations, to help people to organize around policy issues having to do with comprehensive education. And I won't just say sexual health education, but comprehensive education. And we dealt with a lot of issues that adolescents often face, i.e., partner violence. Where boyfriends are slapping the girlfriends, and them, or it could go the other way as well. But people understanding social boundaries, etc. So I did that work for a while, and then of course one of the things I do fairly well is grant writing, and some of the agencies had contacted me about assisting with developing grant applications, which I do that, and so it's just an umbrella to allow me to do the work and to organize my finances as best I can, and sort of keep me out there doing interesting things. I think most recently my work has been with a federally qualified health center in New Orleans, and again I helped them to write a very lucrative grant, and we were successful because I have a maternal and child health background. I was one of the initial directors for the Healthy Start project. That was i.e. this was the, what do they call initially? It's when they are being initiated and then they go to a replication phase. Well, I was there from the beginning.
Wow.
And so got a lot of experience with training and utilizing community health workers. So I just have this vast experience, and it's available for entities that.
And not only in New Orleans, it can be available to anyone, anywhere.
Yeah, absolutely. Yeah, I did some work with the Healthy Start Project in Omaha, Nebraska, and
Well, if
several communities.
Perhaps one of our listeners or our viewers who are struggling to either design, develop, and launch an adolescent health program, or even what's the right start? Maybe it's a program under an established organization, or they want to scale to actually meet more communities because they're part of that community health network that adolescents or behavioral health wing of a hospital may be teaming, and there's a drought. How would they get a hold of you? We have just a few more seconds, but I want to make sure that our listeners can tap you.
Yes,
the resources.
Should I give a phone number or an email?
Email
is kind of complicated.
Yeah,
it's complicated.
Yeah, it's too long.
Whichever you feel comfortable with.
So my area code is still 504, which is New Orleans. So 504-491-4420.
Outstanding.
And you can always find Donna. She knows how to find me in terms of.
And we know how to, all of our.
We alerted some people to listen in today.
Absolutely. So we appreciate you, Dr. Broussard. We appreciate what you're doing and bringing attention and spotlighting adolescent health and programming. Very critical, near and dear to my heart because I'm right in that vortex. So this has been the Health, Wellness, and Lifestyle Program with myself, Linda Dorman, and Dr. Donna Christensen and Dr. Marsha Broussard. We will see you next Wednesday or the Wednesday after next. And have a great afternoon, everyone. This has been programming on Our TV Network. Take care.
Thank you so much again.
So much for inviting me. Thank you, Donna.